Welcome back. This segment is paid for by Mercy Health. Gynecologists are doctors who specialize in women's health with a focus on the female reproductive system. Mercy Health Physician Partners OBGYN has 9 locations in West Michigan, and Leanne sat down with Dr. Maggie Forg to learn more about when you should begin to see a gynecologist and what services they provide.
I really don't like to put a label on when somebody should come to a gynecologist. I really want people to feel comfortable to come to us at any point in their life, because we really try to span all ages and we try to hit all milestones. So if we have teenagers that want to come talk about periods or bodily changes, if we have people in their 20s who haven't come yet that have questions, we just encourage them to come whenever they feel comfortable. The need to come to a gynecologist, you need to start having pap smears and pelvic exams at the age of 21. So if you haven't come yet, definitely come then, but please, we really encourage people to come sooner. We want everyone to feel comfortable with their bodies, and we want to work through that process with them. And I just really want people to know that just because you're coming doesn't mean you have to have a pelvic exam your first time. We will work with you to make you comfortable, because this is something you're going to have to do forever, and really having that first visit go well is our goal. A lot of people like to have a caregiver with them just to hold a hand or help answer some questions that they might not know. And I have a lot of people who really like to be alone, because we are talking about personal issues. And sometimes they just like to have that safe space between their physician and themselves or their provider, and to be able to ask open and honest questions. The newest recommendations are that pap smears start at the age of 21, and you need to have them every 3 years. So it used to be annually. It's a little confusing for patients. It used to be annually, but it's really only every 3 years now. What you do need to have annually is a pelvic exam. So we still want to check on that uterus and the ovaries. The pap smears are just for cervical cancer screening, but yearly you need to have a pelvic exam. The other annual screening that will eventually come in a woman's life is mammograms for breast cancer. And those can start anywhere from the ages of 40 to 50, once you've sat down with your provider and had that discussion about your risk factors and when you should start having your annual mammograms. A woman's body is really quite amazing in what it can do and where it starts and where it ends. And we really try to focus and lend a helping hand and a guiding hand through all those changes that women go through. As a teenager, it's mainly talking about periods and acne and mood changes and questions about sex and pregnancy prevention. And then into our 20s and 30s, it's a lot of pregnancy care and what are my periods doing. And then we get to 40s and 50s, and it's really that big menopausal transition. But we see women all the way up into their 80s and 90s, most commonly prolapse issues. But we really try to just kind of be there for you and kind of just help you understand what's coming and what has happened in the past. So average age of menopause is about 51, but signs and symptoms can start up to about 10 years prior to going through that transition. The most common signs and symptoms of menopause are going to be hot flashes, night sweats, and insomnia are going to be kind of your biggest signs and symptoms. We provide services for pregnancy care. We provide services for family planning. We provide services for period changes, fibroid issues, vulvar skin issues, UTIs, menopause transition. We really try to hit in that menopause transition about looking at all the different aspects in life that plays into menopause, and looking at the total mind, body, and spirit, and looking at the goal of each individual patient, because that menopause transition is truly different for every patient that we encounter. So we really try to look and listen to what their goals are and how we can facilitate them with natural and medical therapies to kind of get through that transition. We have gone into this field to help women, and this is what we live for, and we want people to feel comfortable with us, and we want them to know that we will answer any question, no matter how strange it feels to them, but this is a safe place for them to talk about what's happening to their body, why it's happening, why is sex changing, how can we improve it, how can I improve my health, overall health as a woman, and we are here for that.
And if you'd like more information or to request an appointment with a Mercy Health OBGYN provider, go to mercyhealth.com/GYN.